So in NSCLC there are several agents that are under development for the management of these patients. It's a kind of orphan situation because these patients usually are treated as the other non-small cell lung cancer with chemotherapy, possibly combined with immune checkpoint inhibitors in the first line setting, and then docetaxel and this kind of things. We may treat those patients with some HER2-directed agents, such as Trastuzumab, but there is no clear prospective data. There are new agents in this setting: T-DXd, Trastuzumab deruxtecan, which is an ADC targeting HER2, which is mostly developed in breast cancer. We have data from the DESTINY-Lung Phase II study reporting on in the same setting, the late line setting, possibly in patients who were pretreated with HER2 agents. The response rate in this cohort of patients was 50%. We also have other TKIs such as Tucatinib, another HER2-directed TKI, and the results are also presented during this meeting, and pretty similar results, kind of 70% response rate in those patients with advanced HER2-positive non-small cell lung cancer. So the key question is what is the best sequence for those patients? We have mostly now data in the late line setting in patients who previously received chemotherapy. The first question is how to move to first line, and the ongoing DESTINY-Lung04 study is assessing T-DXd versus chemo plus IO in the first line setting for those patients. So the study is still ongoing. And then the second question is the sequencing of these agents. Should we give a TKI first and then T-DXd or another ADC? Should we start with a TKI and should we start with T-DXd and then covering the resistance mechanism with the TKI? Do we need a combination with chemo? Should we replace chemo or just combine with chemo, especially in the first line setting? So these are open questions for the management of these patients, but this is an unmet need. Those patients are usually young patients, never smokers, and we really need to have a personalized treatment strategy for those patients.